Hi, I'm Dr. Kolesnikova with Women's Pelvic Surgery. So you just scheduled surgery for your fibroid removal and you're having a robotic myomectomy. Let's talk about what to expect. Fibroids, or leiomyoma as they're known medically, are benign growths on the uterus. Depending where they are, they can cause different symptoms. For some people, that's heavy periods. For other people, they have pelvic pressure, constipation, painful sex. To perform a robotic myomectomy, we use small incisions in the abdomen, and we place our camera and instruments to perform the surgery minimally invasively. The fibroid is removed completely and safely. If the fibroid happens to be on the larger side, an additional small incision may be needed to remove it safely. So before we even get to surgery, there's some things that need to be done in the office. Depending on your age and your medical history, you might need to get medical clearance from your doctor. We'll let you know if that's something that you specifically need. You might need additional testing done depending on what kind of surgery you're having, which could include a pelvic ultrasound or a urodynamic test of the bladder. About a week before surgery, we'll see you in the office for your preoperative visit, where we'll go over the details of the surgery, answer any final questions you may have, and sign the consent paperwork. You will also need to get blood work done at the hospital for your blood type. The hospital will call you with this appointment a few days before surgery. Then, on the day of your surgery, you should stop eating any solid food 8 hours before your surgery is scheduled. You can continue to have clear liquids up until 2 hours before your surgery and expect to arrive to the hospital 2 hours before your scheduled time. This surgery, like other major surgeries, has similar risks. These include bleeding, infection, damage to the surrounding organs, which is your bowels or your bladder. Most commonly, these surgeries go fine and there are no complications. And if there are complications, most often they're minor, like a urinary tract infection or an infection of the skin. Because we specialize in robotic minimally invasive surgery, the recovery is quick and there's no need to stay an extra day in the hospital. So as long as you feel safe, the majority of our patients go home the same day. Once you're home, you can do your regular activities as long as you're not in pain. It's safe to walk around, use the stairs if needed, and shower if you feel steady on your feet. You can start driving within a few days of surgery as long as you feel safe doing so and are not taking any narcotic medication. The only restrictions is nothing in the vagina and no heavy lifting. When you're at home, the best way to manage your pain is to take Motrin and Tylenol. You can take the two together every 6 hours, or you can stagger them and take them every 3 hours. We also send you a strong pain medication, which is an opioid. If you need it, you take it for breakthrough pain. One of the most common things that patients experience after surgery is constipation. So stay on top of that. Take Kolase starting the day you leave the hospital and just continue it for the next week, unless you're having diarrhea. Remember, if you're having concerning symptoms like a fever, vomiting, pain that's not controlled, bleeding, or you're concerned that something is going on, please don't hesitate to call the office. So if you have any other questions, you can set up a consultation with us. Otherwise, we'll see you at your preoperative visit.